that's not a bad idea. So then he started his own channel, and for would you be like would you feel comfortable talking about, like how's your mental health journey from then to now? Like you don't have to go in full in depth if you don't want
Yeah,
to.
yeah, no, 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 yeah, yeah, yeah. No, good question there. I would like to go in depth so I can help other people struggling.
Yeah,
Well, so I went for a couple of months, I was like, my mindset was like, I know a lot of people who have addiction or have had mental health, it's like, I'll be fine. That's always the word if you have an addiction. And
yeah,
so I can control it, like I can control this and that, because I have a lot of family that like to drink and all them. I had a great grandpa who always he passed away drinking a lot, so he was always like never wanted help. He never with my grandma. You already met my grandma. That's her
yeah.
dad. She always did. She took them, to where they take people who are addicts.
Okay.
So
So
he never wanted help. So for me, it was like, in my case, it was like I'll be fine. This is just it's just a short term thing. I'll be okay.
yeah,
I know a lot of people with mental health or addiction said that once in their life, like, I'll be fine. I know I can control this.
yeah.
But at the end of the day, it's like you're just denying yourself. You're lying to yourself basically 'cause you know you can't anymore.
You're like
So for
digging
me,
yourself in a bigger hole where, it's going to be
yeah,
harder to crawl out of.
exactly. That's why I mentioned like everybody, not to criticize people. I'm just saying like how we are sometimes.
Yeah.
We're like, I'll be fine. I was there. I'll be fine. Then the months kept going. I'm like, yeah, this is not, doesn't seem, there's something more here. So I went to the appointment that I was telling you where I see a lot of people.
Yeah.
And sometimes I see social worker, they ask questions, how am I doing, this and that. So I was like, I'm dealing with this. Where can I be referred? And then the social worker gave me like a flyer of a place here in Fresno, California, I think called Olive Therapy, something like that, for those watching here in Fresno.
Okay.
And well, you guys need like therapy or whatever, see a therapist. I think that's what it's called, but I don't remember like how the full name, but it's Olive Therapy, something like that.
Hmm.
And they see people with disabilities, people in wheelchairs, and I think I saw one of the therapists being in a wheelchair.
So that was like, that made you more comfortable, because you're seeing you're not the only one.
No, not just that, because the social worker was like, and that's not really that kind of talking about bringing a therapist, like, or therapist really prepared to see a patient with any mental health issue that has a disability.
Yeah.
And some therapist, like the social worker, will be like, they will be like, oh, nothing's wrong with you. You'll be able to do, you're fine. You're gonna do that. You'll be able to do that. They encourage you to do things you're not able to. So that's why she felt like this was the right place because they see different patients with muscular dystrophy.
Yeah.
And also I think when I get to the lobby of the appointment it says muscular dystrophy and ALS, that those are the patients that they see. So obviously everybody like different stage, adults in different ages.
Yeah. And,
So there
and
were
how often when you were navigating this process, this journey, like how often were you seeing your therapist? How often were you getting help?
every she did first she did an eval, obviously, got a little bit of a background with me, and then she wrote notes. Then at the end of the first session, she was like, after analyzing the things you told me, you're suffering not from depression. That was like the first thing I was thinking, but like it's not depression because you're still doing stuff.
Yeah.
But she was like, it's isolation. For those that don't know isolation, she mentioned that it affects older people and people with disabilities in general because like there's no social connection.
Yeah.
Because as humans, we need social connections or something to do as well, not just something to do outside of your home because you can feel like you're stuck in a room. Like those that have, I don't know what it's called when you can't be in a tight spot.
Claustrophobic.
Yeah, yeah, that was what it's almost like that
Yeah.
to feel like you need to do something because you don't know social connection. So it's normal for people with disabilities. So I feel like it's best that I see you once a week so we can discuss what things what can help you keep your mind off of it.
Yeah. And then so now let's talk about present time. Like, how's your mental health journey? Like, I know you were seeing a therapist like once a week, right? And then it moved on to like every other week. Like for
Yeah.
someone like the purpose of me asking this question is, someone navigating mental health, like what can they expect going through a season? And like, is it permanent? Like, is it possible to get better? Like, I want someone to see that transformation.
Yeah, yeah, I like that question. Great question, great question. Yeah, I feel like, oh, I'm gonna say if you put in the work, if you put your mindset, I'm gonna get out of this hole. You're not calling it a hole. It can feel like, oh, I hit rock bottom, but the issue is not rock bottom is easy to get in, but it's hard to get out of the rock bottom, whatever you're dealing with personally. But if you set your mind to it, like, I'm gonna get out of here. I don't care how much it takes. It doesn't mean I don't care. It's like the mentality that I don't care how hard it is. That type of mentality. Not that I'm careless.
Yeah.
It's that I don't care how much obstacle I go through. I'm getting out of here for whatever reason. So for me, like if you're dealing with something like that, always set your mind to. It's not easy.
Hmm.
Just want to be clear that it's not easy. Anything you're going through, disability or any sort of what you may call it, mental health,
Hmm.
it's not easy to get out. But if you put in the work. Sometimes people say, "Oh, therapy doesn't work." I went to see a therapist, and that you blame the therapist. Sometimes it's you not putting in the work,
Yeah.
but also sometimes it can be sometimes you're in the correct, meaning saying, "Oh, my therapist is not great." That can happen as well. Don't feel like you have to. From what I learned, don't feel like you have to stay with the therapist if you feel like it's not helping you. But really pay attention which one it is. Is it that you're not putting in the work, or it's the therapist's fault before you blame anybody?
Yeah. Take
So
take
for
take accountability.
Yeah, first focus. I'm not saying like, oh, there's something you're doing something wrong. No, no, no. Focus first. If you feel like the therapist is helping you, but you're not putting in the work, that's like try to like feel like do the work. I know it's hard. I'm not saying it's easy. It's not like, oh, I'll put in the work today and tomorrow I'm 100% better. No, can take years. Everybody's journey is different. So just
Yeah.
because someone went to therapy 1 week, for example, I know it's not a week that you go several months or a year,
Yeah.
but it's just an example.
Yeah.
Just so I don't explain the whole thing. So it's like you put in the work, like if it's once a week, don't focus, like I said, on everybody's journey. You just focus, see therapist, ask questions on your therapy. Like for me, like the last few sessions, I'm like, how do you see my progression? She was like, I see like from when you started, I seen like a huge difference. So always ask questions. How are you doing this? How am I doing? Am I ready to go? Am I ready to go? Get out of therapy or not?
Mm.
Always ask. Don't feel like, oh, I'm leaving because I'm tired of therapy. No, no, no. That's not how it works.
Yeah. You got to be consistent and eat. Yeah.
Be sure like you're ready because sometimes people get out early, from therapy, and it's like, oh, I'm ready. Then they few months or a few weeks later they go back, for because they're like, oh, I'm not better. I need to go back.
Yeah. So we'll move on to this next question, but so are you now still seeing therapy? Like, what is that? Are you on mental health medication? Like, what is that like?
Right now, they didn't give me medication because there's no medication for isolation. Depression, yeah, they'll give you medication from what I know.
Yeah.
But right now, no, I'm not seeing because I'm a lot better. But my therapist, like, if I ever needed to go back, I can go back, whenever I needed it, but right now we're good.
Yeah. I
So
got you.
it's not every mental health needs medication. I think depression or it depends on your therapist, honestly.
It depends on the severity of it too, but yeah.
Hmm.
So how has sharing your story online helped you heal, or has it sometimes forced you to relive difficult moments?